Hello and welcome to the Valley today. I am your host, Janet Michael. It is Community Health Day. That is the day every month we jump on a Zoom with someone from Valley Health. They, of course, sponsor this program. February, as you may know, is Heart Month, so we're going to learn a little bit about how to be heart healthy. To that end, Dr. April Shewmake is joining me. She is a board-certified interventional cardiologist with Winchester Cardiology and Vascular Medicine, Valley Health. So thank you, Dr. Shewmake, for taking some time this morning to educate me on heart health. I'm excited to see if I've been doing it right or if I need to improve on some things.
Well, thank you. I'm glad to be here.
So before we dive in, tell me a little bit about yourself. Give me some of your background and talk to me about your areas of expertise.
You already said I'm an interventional cardiologist with Winchester Cardiology and Vascular Medicine here at Winchester Medical Center. I went to medical school and then went on to complete my internal medicine residency, then a cardiology fellowship, and then did a specialized year in interventional cardiology. So what that basically means is that I treat heart attacks and deal with complex coronary artery disease using minimally invasive procedures. And that the cath lab is where I love to be and treat my patients. My kind of clinical passion is complex coronary disease or treating difficult, complex blockages with lots of great new special techniques and technology that we have at our disposal.
Is that what sets interventional cardiology apart from, say, general cardiology?
Yes, so general cardiology is actually a large part of what I do. It is managing, diagnosing heart conditions with imaging, using medications. It's the long-term care that we provide, and it's where the prevention piece comes in. So before things become an emergency or a heart attack, or that you have to see me in the cath lab, that's the general cardiology piece. So the interventional piece is that we treat the emergencies, heart attacks, by opening those blocked arteries with catheters, balloons, and stents in the lab.
Are you finding that so much of this is congenital, or is it that people are just not taking as good care of themselves as maybe they should be?
Well, a little bit of both. So the genetics do matter. However, a significant portion of heart disease is preventable. Evidence suggests up to 70 to 90% of heart disease is preventable. So it sounds very simple, but the daily habits like diet, exercise, blood pressure control, sleep, and stress, as well as remaining tobacco free, are super important aspects of this.
Are there early warning signs for someone that they should be paying attention to that maybe could get them some help before it gets to that heart attack level or that blockage level?
Yes, absolutely. So the big ones are sort of chest pressure, shortness of breath, fatigue, dizziness, nausea, or pain that radiates up to the jaw, down the arms, or to the back. And symptoms that come on with exertion are especially important to note because that's the early warning sign. It's those kind of symptoms that I just mentioned with exertion and physical activity. And then that get better if you rest.
I think that television has not necessarily helped us understand what an early warning sign is. So many times we see on TV that somebody is rushed to the hospital because they think they're having a heart attack and it turns out to be indigestion. To me, those seem like two very different symptoms.
Well, sometimes people actually miss a heart attack and delay coming in because they do think that it's just indigestion. Young people are especially prone to this because they think I'm too young to have a heart attack or heart disease. Women also often present atypically or sometimes not with the typical chest pain, but nausea, shortness of breath. Oh, I'm just having indigestion. So unfortunately, that does happen. And sometimes it is just indigestion and they come to the hospital and it's not a heart attack, which is always good news. But, we just want to say, don't delay. If you think something's wrong, come to the hospital.
Years ago, when we were still doing these shows live in the studio, I spoke with Dr. Gaither.
Yes.
And he was adamant. The one thing that he wanted to make sure that people understood, and he mentioned it several times throughout our conversation, was if you are even slightly thinking that you could be having some sort of heart attack, do not, under any circumstances, try to drive yourself to the hospital. Call 911 and get an ambulance there. And I have repeated that. So he'd be so proud because I have repeated that so many times over the years.
Yeah, absolutely. It was actually on my list to say as well, like call 911, don't delay, don't drive yourself, don't wait it out. And yeah, don't just assume that it's indigestion or some minor thing when you know that something's wrong.
Are there different risk factors for men versus women?
Women have different risks than men. Sometimes we present later in life, but then have more complex disease. And again, don't always have symptoms which are textbook and thus can be sort of underdiagnosed or missed, as well as sometimes we are, like as women, dismissed with our symptoms. We also have different issues such as hormonal changes, going through menopause, pregnancy related issues come up, and then autoimmune conditions. So, nearly 45% of women over the age of 20 actually have cardiovascular disease, and yet also less than half of us recognize that we do.
Are there things that we should be talking to our primary care physician about? Are those the things that if we understand that early on, that we can do certain things from a prevention standpoint or be more aware of if this, then that?
Yes, absolutely. And so the earlier you start, the better. So things that I already mentioned, like those daily habits of diet, exercise, stress, sleep, and moving more. But the other important thing that, like you said, you can go into your primary care physician and start working on is we say know your numbers. So those numbers are cholesterol, your blood pressure, your BMI, and your blood sugar, because those are the important risk factors that you can develop heart disease later in life. The other important thing is remaining tobacco free or quitting smoking if you do smoke.
Valley Health offers several programs in particular for people who do smoke that want to quit and just haven't been able to get over that hump.
Absolutely. And something that you can come into your primary care or heart doctor if you already have one. There are medications. Like you said, there are resources. It's probably the most difficult thing that people can do in their lives. It really is, but such an important step to take.
Feel like we as women tend to take care of everybody else. Like if our spouse, if our husband or our sons or our kids were experiencing anything that even slightly resembles these symptoms, we're the first ones to insist that they go get care. But when it happens to us, we're like, oh, it'll be fine. I've got these other things to do. It can wait. The mental portion of it, I think, for women is a bigger struggle.
Yeah, I mean, it's one thing that I feel really strongly about is sort of closing that gap in how heart disease is recognized and treated in women. And one thing that I would say is that heart disease is still the number one killer of women. 1 in 3 deaths in women is caused by heart disease, and it is more than all cancers, including breast cancer combined. And like I said before, and still less than half of women recognize that it's the biggest threat to their health.
You also mentioned something a minute ago about younger adults, people in their 20s sometimes overlook symptoms. My son is in his early 30s. He said two of his friends from high school that have had heart attacks and died in the last 3 months. And to me, I was thinking, how does that happen to someone in their 30s? One was an athlete. So it really was a bit of a shock. Is that number on the rise?
It is, unfortunately, because cardiovascular risk factors in young people are on the rise. I think my youngest female that I've taken care of with a heart attack was 38, and my youngest male was 30. And so it does happen. So those risk factors like diabetes, high blood pressure, high cholesterol are coming to the forefront in younger and younger people. And then, like I said, especially in young people, the genetics are probably a factor there.
I think sometimes they think they're invincible because they are, and I love that at 30 that they're calling themselves young. I would not have called myself young at 30, but at least
I
we've come
still think
around
about
there.
myself young.
Let's take a break. When we come back, can we maybe walk through some scenarios that someone might be able to recognize a little bit better when it comes to early warning signs or symptoms and what they should do in those cases? Can we do that in the next segment?
Yeah, absolutely.
We are going to do all of that when we come back. It is Community Health Day sponsored by Valley Health. So we are on the Zooms today with Dr. April Shewmake. She is a board certified interventional cardiologist with Winchester Cardiology and Vascular Medicine Valley Health. She is located at Winchester Medical Center. February is Heart Month. So that is what we are learning about today. And we're going to do more of that when we come back in just a couple of minutes.
United Way of the Northern Shenandoah Valley is inviting nonprofits to help map the region's nonprofit safety net. If your organization serves Winchester City, Frederick, Clark, Warren, Shenandoah, or Page counties, we encourage you to take our regional nonprofit survey. The information collected will help identify gaps, support collaboration, and inform community leaders and funders. The survey takes about 30 minutes and is available at unitedwaynsv.org.
Welcome back to the Valley today. I am your host, Janet Michael. It is Community Health Day, sponsored every month by Valley Health. February, as you may know, is Heart Month. So we are on the Zooms with Dr. April Shewmake. She is a board-certified interventional cardiologist with Winchester Cardiology and Vascular Medicine, Valley Health. She practices out of Winchester Medical Center. And we were talking in the first segment, Dr. Shewmake, a little bit about how we as women sometimes play down symptoms or don't always even take care of ourselves as well as we take care of the rest of our family. And I wonder how that then impacts our heart health long term.
Yeah, I think that risk factors can go unnoticed. Taking care of those things like blood pressure, your blood sugar, your BMI, as well as very important component, which we're not good at, is stress management and enough sleep. Even those basics can really, really improve your cardiovascular risk.
I spoke a few months ago with a new primary care physician over at Greenwood, Valley Health Primary Care Greenwood. And we talked a little bit about the value of having a primary care physician. I had someone reach out to me after that show aired to tell me that they had reached out and had made an appointment, and they were going to classify going to their primary care physician as their self-care, that it was going to be the hour they got away to make sure that they were taking care of themselves, because he said something in that conversation about when the air masks drop on an airplane and you're told to take care of yourself first, because otherwise you're not going to be able to take care of anyone else. And I think we as women need to understand the value of primary care, because it does go hand in hand with prevention from a heart disease perspective.
Yeah, absolutely. Unfortunately, these are what we call silent killers: hypertension, hyperlipidemia, until it's not. And you're in the ER at 2 a.m. seeing me for a heart attack. And that's what we want to prevent. And so I think that that is a great point, is to come in and see your primary care as your self-care. I really, really like the analogy of putting on your oxygen mask so that you can take care of others, be there for your children, grandchildren, husbands, and family.
I think sometimes too, we get this false sense of health because every one of us in some way, shape, or form is wearing an Apple Watch. And I think sometimes we think, okay, well, it's going to tell me if something is wrong. And they don't do that. And I have been known to cheat when I'm trying to close that last ring. I may sit at the table and just move my arm in order to get all of my steps in. But I think sometimes they give us this false sense of being healthy when maybe we're not.
Yeah, I completely agree. There are some good advantages to the watch. It can help with some things, but you just can't make up for going in to see a primary care physician, having the conversations about those numbers that we talked about: your blood pressure, your blood glucose, BMI, and cholesterol. As far as blood glucose goes, diabetes is actually an important risk factor here. Even if you are getting that A1C down, getting good numbers for both men and women, it's an independent risk factor. And so just the diagnosis increases your risk. It makes it all the much more important to kind of manage everything else. Even if you're getting in that pre-diabetic range or just starting to get there, that's the time when you can really make the biggest difference as far as lifestyle and risk factor management.
It's important to note that all of those things you just mentioned, BMI or blood glucose levels or cholesterol, those are all treatable things. They're all things that we can control, which makes it even easier to take control of our health overall.
Yeah, absolutely. And as far as sort of weight loss and BMI goes, we have some newer, very good medicines to help with that these days and can be appropriate for some people, especially with risk factors like diabetes, high cholesterol, high blood pressure. I will also say that some of the newer weight loss medicines also have good effects in managing cardiovascular risk as well.
I've seen some of those commercials on television, and some of them specifically mention that they've been able to lower their A1C, which again is another good benefit, not only from a weight loss perspective, but in overall health.
Yep, absolutely. So not only managing your blood sugar, but helping with all of your other risk factors. Very, very important these days. Good options for some people.
We'll run through one of those scenarios. For example, someone who is otherwise healthy, they're active and they eat right, but they do have diabetes or they have sleep apnea and they think, okay, I'm doing all these other things right. So I'm going to be fine. My heart isn't something I need to worry about. It really is, though, right?
Yes, and especially as you age. So those kind of things can sneak up on you. And then, as we talked about before, the genetic component can kind of sneak up on people as well.
Are there other situations or scenarios that you have seen or that you know happen from people that just didn't think that they were someone who had any risk factors because something they'd always lived with or always dealt with, they didn't think about anymore?
Yeah, absolutely. And some people come in and based on our risk profiles and everything that we know, they saw their primary care physician said, no, you don't need a cholesterol medicine. And they can still come in with a heart attack and develop heart disease, especially later in life. So sometimes you can do everything right and the worst case scenario happens. But that's why I'm here and we're here to help take care of people in those emergency situations.
So let's talk about that for a second. So let's say I go to see my primary care physician and my numbers aren't necessarily where they should be. And he recommends that I then see an interventional cardiologist. Are you accepting new patients? Would he give me a referral? How does that process work?
Yep, absolutely. And I would probably have my general cardiology hat on at that point, hopefully. And our group does a lot of general cardiology and those kind of referrals to help manage risk factors. And again, prevention is everything. So yeah, happy to see you, especially if primary care recommends that we get a little better control on some of those numbers.
Is there ever a situation where the patient may tell the primary care, I know you said this is okay, but I'm still a little worried. Could you give me a referral anyway? Does that happen?
Absolutely. Actually, I see lots and lots of people for that reason. And it's always very good conversation. We talk about family history, the kind of numbers that we were just talking about, exercise, diet, and we can kind of go more in depth in just that avenue. We also sometimes recommend other tests or studies to really evaluate risk as an individual. There's some very specialized cholesterol numbers that we can obtain. So it can be beneficial to come see a cardiologist.
When I talked with Dr. Vokema last month, one of the things that he stressed as well was a primary care physician isn't going to be an expert in all fields. And that's why it's so great to be able to get that referral from a primary care, particularly in heart issues, and talk to the person who is an expert in that field.
Yep, happy to do that because we do add, like you said, a little more in-depth look in just this area, specialized testing, whether that's imaging or blood work, and we can kind of help guide because everybody's an individual. We can talk about statistics and population risk factors and those kind of things, but everyone is an individual.
So, as we wrap up our conversation today, is there a myth that you can bust and leave people with some really good advice?
One of the biggest myths is that heart disease is just a man's disease. It's so important that women recognize their own risk. And like we already said, it causes 1 in 3 deaths in women. And unfortunately, women don't recognize the risk. I think we do recognize it in men. We know that heart attacks are the #1 killer in men, but it goes under recognized in women. The other takeaway points that I would emphasize would be just listen to your body, take your symptoms seriously. Heart disease is common, but it's preventable and treatable. advocate for yourself, especially when you know that something's wrong, and specifically as a woman. I would also say that, again, those simple things, those everyday habits really do make a difference. Eat well, move more, manage your stress, get enough sleep, and then know those numbers, your blood pressure, your cholesterol, your BMI, and your blood glucose. So I would just say early action saves lives. Awareness is everything.
I'm going to have someone on from Valley Health in a future show about that managing your stress thing. There's somebody at Valley Health that can help all of us with that. So that may have to be a future topic.
Sounds good to me.
Dr. Shewmake, thank you for taking the time today. I do appreciate it.
Thank you so much for having me. I really enjoyed it.
I will be back tomorrow with a brand new episode of The Valley Today, a few minutes after noon. So meet me here then.